I was in pain all the time. I could get out of bed in the morning and limp to the bathroom.
I had such a terrible pain with my right foot, the heel, the plantar fasciitis problem. I could not walk.
I decided I wanted to do some running and do a triathlon, and I started running on a treadmill and just could not run.
My ankles were very weak, and actually my ankles could roll, and I could lay them down on the ground and I could roll them back and forth.
Because of my pigeon toe, I'd probably have like arthritis in my back.
Flat feet, or hyperpronation, is a medical condition that can affect more than just your feet. Throwing your body's alignment off due to faulty foot mechanics can ultimately contribute to countless deformities.
What this condition does for the patient is it produces problems, most specifically they'll get abnormal motions of the foot, which causes strain on the ligaments and tendons, and cause problems with not only the foot, but the knee, hip, and back of these patients.
I had a lot of back pain and knee and hip pain, especially after long walking, standing in a grocery store, anytime waiting in line.
My feet started causing problems where the bones shifted, I guess, and I started having pain just from running.
Here we have a foot skeleton, and this is the ankle bone and the heel bone. The sinus tarsi is the space in between these two bones. So what happens with hyperpronation is that the ankle bone is just sliding right down and closing that space over.
I started with orthotics 20 years ago because at the time that was the only way I could correct a foot problem.
I tried everything over the counter that was possible. I tried over the counter orthotics for my shoes, the heel cups. I had custom made orthotics. I had acupuncture, I had massage.
I couldn't go and pick off a pair of shoes off the rack. I had to have special shoes that would accommodate orthotics, and they were not always attractive.
For a lot of people, orthotics don't work because they hurt inside their arch, inside the shoe. They can't wear them because they either their foot is too flat or it's just uncomfortable.
In the past, there have been many forms of treatment for flat feet, but up until now, none of them really made sense. Thanks to Dr. Michael E. Graham, podiatric foot surgeon and the inventor of HyProCure sinus tarsi stent, that has changed.
For decades, we've been placing different materials and different designs into the sinus tarsi. But there was problems with tolerance and with the material itself. So some of the materials were made out of plastic, and so after a while they would break down. Well, that's no good. And because of the poor anatomic design of the other devices, after about a year or 2 years, they'd have to be removed. And that's why I developed HyProCure, is because it goes in at a different angle and it has a completely unique shape compared to all of the other devices on the market.
The advantage that the HyProCure has over these old implants is the design, which is the most important thing when you're doing this procedure. It's addressing the canalis portion, which the others do not do. The fact is that patients don't run into a risk of having a high removal rate, and patient success is phenomenal.
HyProCure from Grammatica is an internal solution for this internal problem.
It offers a permanent solution to the clasped space between the talus and calcaneus bones in your foot. However, it is completely reversible.
There are minimal potential complications from the procedure with a relatively fast recovery, especially when compared to the traditional flat foot reconstructive surgery.
My newfound mobility is that I can continue walking and going for walks with my dog and camping and through the trails, and I love my job. I'm a nurse, and I can continue my 12-hour shifts, which I absolutely love.
I'm pain-free now, completely pain-free. I've had both feet, had the stent put in both feet, and I have no pain. I can get out of bed in the morning and not worry about limping to the bathroom.
So after the procedure, I was able to run again with no pain, no problems. Since then, I accomplished 3 marathons. I've been a triathlete and have even accomplished my first Ironman over the past summer.
I love the way I feel when I'm walking now. I feel like I'm standing straighter. I just feel good.
It's like an internal orthotic. It's always helping you, no matter if you're barefooted or wearing 4-inch heels.
With HyProCure, you get it done once and it's permanent change. You don't have to deal with it again.
It's a minimally invasive procedure. It takes less than 10 minutes to perform. It's outpatient, just a minimal incision. And basically the stent is just pushed into the space. There's no drilling or screwing of the stent into the bones. and the patient's walking immediately after surgery. There's going to be some soreness, and the post-op pain is going to be different from one patient to the other. But generally within 4 to 6 weeks, patients are running and jogging.
Every year, millions of people undergo treatment surgery to their knees, hips, and back, when the root cause could be in their feet. Gramedica's HyProCure represents a real lifelong cure for flat feet. It permanently corrects the problem at its root and immediately works on the many symptoms, ultimately restoring the patient's quality of life.